Yeah, so I'm going to introduce you to product development and services, product and service development, marketing, customer experience, satisfaction. And we're going to do that, bear in mind with ISO 9001 2015. My name is Ivan Strom and I'm the CEO for MMA Labs. Now, my outline, the first we're going to look at is the healthcare framework. So I'm going to look at the modern healthcare system, the patient or the consumer, the role they play. Then you look at the concept of product development, customer service, and feedback. Then we'll conclude the entire training on the closing remarks, where we will state our position on quality and also make some announcements. So the healthcare framework, this is a universal framework that has been adopted for years. So you're looking at the patient safety, sitting at the center, revolving around it is the quality culture. You are looking at innovation, you are looking at teamwork, you are looking at um, extraordinary care, effectiveness, access to healthcare, team focus, efficiency, safety, and the patient and community centeredness. So, in all these, you have to know that the modern day digital health approach um, is in context of these um, various sections of the healthcare framework that is being adopted. So you are looking at key drivers, you are looking at quality improvement, you are looking at accreditations, legislation, government policies, regulatory and legislative instruments, healthcare engagement, and all the other things that ensure that the quality healthcare outcome is ensured. So I want you to know that this healthcare framework is in context in the modern day digital health approach. Now going into details, I'm asking this question: where do you sit in today's digital health era? So as a health professional, where do you sit now? Okay, this is an important question I want you to consider. Now going deeper, I want to read this written by Dr. Betala Mesko. And he said that the patient becoming member of their medical team is the current digital health paradigm shift. So in today's healthcare, you are saying that the patient is part of the medical team. You don't just ignore the output and the contribution of the patient. Once you do that, then you are limiting the framework that has been adopted over the years. In today's healthcare delivery system, the patient or the client plays a critical role. That if you abuse it, then you are going to have issues in your healthcare system. Now, when you look at this chart from the medical futurist, the guide to the future of medicine, you realize that the patient plays critical roles in most of the current healthcare operations. Then, also in the future, you can see that the patient will have a lot of role to play. So, in this, I say that the patient is equally as important as you, the professional. So, you should have this at the back of your mind that, in as much as you have the patient as your client, you, the professional, in as much as you are important, the patient is equally important. So when you look at this chart, those in green are those that are being achieved now. So it means that those things are already in operations. Then you look at those in yellow, those are in progress, which means that we are already implementing them in one way or other. Then those in red are what the future has for us. So if you look at medical AI policy, it said it's in progress. Artificial intelligence in medical decision support is in progress. Nutrigenomics is in progress. So if you're a dietitian, you should know about nutrigenomics. Okay. Then laboratory, let's look at data input and diagnostics. So laboratory sensors, digestible sensors, organ on a chip, medical tricorders. So all of these things, telemedicine is already achieved. Evidence-based mental health is also achieved. But in the future, we are looking at holographic data input. Then ongoing, we are looking at implants, microchips. So all of these are um, modern day healthcare approaches that you have to consider. And in doing so, you have to consider the patient who sits at the center and by whom all other decisions should revolve around. The next key thing I want is a big statement. I said healthcare is not only about what happens in the hospital or the clinic. So healthcare is broad and it has a lot of players in it. So if you are in healthcare, you should know that um, healthcare is not about just what you are exposed to in the hospitals. Every other, there are several others who may not be in the hospital, but they are playing a role, and so you can't just ignore them. Okay, so healthcare is not only about what happens in the hospital. So if you take the pharmaceutical companies that are developing the drugs, if you look at even those who are doing the research behind what we do in the hospitals, they all play their significant roles in the healthcare delivery system. So don't be tempted to think that healthcare is about what happens in the hospital or in the clinic that you find yourself. With that, I said I have this question. The first one is that is healthcare a service industry or a production industry? The second one is your field of practice a service industry or a production industry? By knowing this and knowing where you stand, then of course, any service or product that you develop, you consider how you should go about it. So if you are in the laboratory sector, for instance, laboratory, I consider the laboratory sector to be a twofold sector where you are looking at both service and also producing results. So it's both the production industry and the service industry. Maybe the dietitian will consider more of service, but where they have to produce something, then they will consider the production aspect. Right. So if you know where you stand in in the healthcare industry, then you'll be guided on product or service development. Now let's narrow down to the products, and I'll put in here all the players around healthcare from investment and all those health insurance and all of them, they are here. So any product or service you want to put across, then you have to look at these players. The patient or the consumer is the one that any product or service that you are going to put out there should be revolve around. Then the organization in which you are, they are interested in the return on investment. Okay, they are interested in the return on investment. Then you have the other players, so the governmental organization, the regulators, they are also there because they are looking at the economic benefits and how your product is going to affect the economics of the jurisdiction where you find your product. So knowing that there are a lot and many interest groups in the service or product you put out there is the reason for standardization. So all this training that we've had for the last 5 days is around standardization, such that whatever product you are trying to put out there, whatever service you are providing, you're looking at standardization, trying to make the product as much as standard as possible, so that when the same product is taken to other jurisdiction, then you can't be punished for doing the wrong thing. Now, standardization ensures these three things. The first one is quality, safety, efficiency of the product or the service, and the entire system. So whatever product you want to bring out there has to revolve around this. And that is the reason why you have to put in the standardization. And in fact, that is the reason why we decided to come out with this training, so that we appreciate why things has to be standardized in our workplaces. Okay. Now, can one say standardization is lean at protecting the consumer? This is a question that is debatable, because the businessman will say yes, but the patient will also say that it also helps the company to grow. I think Brad John explained the benefit and the pros and cons of all the angles yesterday and the day before. So yes, standardization in a way protect the patient, because laws, they say, are made for the weak. So it is believed that the organizations are more powerful. So we have to put in some ways and means to protect the lesser in that ecosystem, and that bring the consumer as a beneficiary of standardization. Now, we've gone through the ISO 9001 2015 for 2 days. I have just summarized it because it has to do with the product or the service you are putting out there. The first one is organizations needs to demonstrate its ability to consistently provide products and services that meet customer and applicable statutory and regulatory requirements. So the keywords are the customer, the applicable statutory and regulatory requirements. The applicable statutory and regulatory requirements are also geared at protecting the consumer. So you could see that any product you are bringing out there or the service you are rendering in your facility is revolving around the customer, the patient. So you will have to make sure that whatever you are doing is standardized so that the patient will be the beneficiary. The second one is that organizations should aim to enhance customer satisfaction through the effective application of the system, including processes for improvement of the system, and the assurance of conformity to customer and applicable statutory and regulatory requirements. The same revolving around the customer satisfaction. So the customer is very key in whatever service or product you want to put out there. And it says that all the requirements of this ISO 9001, they are generic and universal. So independent of the organization where you are working, these principles cut across, okay, regardless of the type or the size or the product and service it provides. These principles cut across. So whatever we've gone through the past 5 days, if you have a small side hustle business, you can apply it there and it works. Just as in our hospitals where we operate from, we have to encourage ourselves to apply these principles so that we achieve quality of care. Now, this is a general knowledge when it comes to product development. If you are coming up with an idea to start, say, a laboratory, then there are things you have to do. There's a concept and design stage where the idea is refined. You try to read around, do your small research around the idea, including the customers, and make sure that whatever product or service you aim to provide will be of benefit, and in fact is going to meet the customer's needs. Then there's the stage where you actually develop the product, or you start produce the product and generate prototype. So in most labs, you realize that most labs will start, and usually the prototype is to start medical screening and those stuff. So once you realize that you started medical screening and it started working, now you begin to think of getting an office to start the lab, because now you see that you have some few customers. So that's the development stage. Then there's the production and the launch, where you actually start to market whatever you have come out with. So if it's a lab, this is the stage you start putting in the machines and start testing. All right. Then you have the service and support. So after you produce, you send the results to the patient. Now the patient will begin to call you and be asking you about the results and all those things. So there has to be measures, quality measures, to monitor all these stages. And those are what we've gone through, keeping the records, getting policies as to what and what should be done, and all those things that we've discussed in the last 4 days is revolving around this. Now, the last one is the retirement, where if you have a product, after some time, that product would start declining in the market. That is why in bigger companies, once they realize that the product is going down, then they will produce another one and they will start marketing that one. So if you don't adopt to innovate your product, after some time, that product will become extinct and people will no more be interested to purchase that product. And that is the reason why you also see that most labs will start, after some time, you realize that the influence of those labs are no more. Hospitals are started, very nice, doing very well. After 5-10 years, you realize that because they couldn't maintain the standard in the product and the service they are rendering, the market share of that company begins to go down. So you have to adopt. And one of the strategies to adopt is what we've discussed. Keeping the records, doing the right things, ensuring quality products are given. Then every now and then you remain relevant in the market. Quickly, this is a curve. Once you start the product, you start sales of the product, there is a curve that the business will go through. So we have the introduction stage, the growth, maturity, and the decline. At every stage, there are things that you have to do. Okay, so if you look at the curve, sales against time, you realize that when you introduce the product, the curve is just down there. Then it keeps rising at the growth stage. At the maturity, it plateaus, then it starts declining. So at the decline stage, that is why I said, if you don't do something about it, then your product will come back to the introduction stage where you have to start all over. Then we say that the business has collapsed. All right. So at every stage, there's something you have to do. At the sales level, there's low sales at the introductory level, but at the peak level, you see that the sales is peak. And this is where we say the business has matured. Okay. So at every stage, there is, progress. Okay. So when you start to grow and you reach the maturity, that is where you begin to really, really make profits. So if you are starting your business today or tomorrow, you should know that you are not going to reap the profits within the next shortest possible time. So if you are in a laboratory, for instance, you should give yourself at least like 5 years before you reach at the plateau or the maturity stage. That is where you will be more relevant and be more competitive. All right. The same way, the marketing strategy is different at each level. So if you are now starting, because you don't have the resources and all those things, your marketing is limited. Okay. And that is where sometimes we also consider the pricing. So if you take a sector, for instance, the laboratory, I always say that the laboratory is a twofold industry. We have the service aspect and we have the production aspect. So in as much as you are attending to the patients and they are giving you feedback, you are providing a service, you're also producing results, which is the product. So you can't look at one angle and leave the other. There are labs that focus on, say, the service aspect. So they started opening branches everywhere, but they didn't consider the production aspect. They didn't buy the machines. They didn't put in the quality aspect of the business. Then after some time, you realize that they have the branches, but they are not able to give results. So doctors will start leaving them. The same for those who focus on buying the machines, but they don't focus on the marketing. Okay, if you don't market and get the branches out there, then the same way you realize that your business will be declining after some time, because someone is doing the two concurrently, and that person will grow faster than you. All right. So at the marketing stage, there are all different strategies that you come to use. When you get a slide, you get the very good details. To conclude, I said to achieve success and growth in an organization, you must focus on the customer or the consumer. You must also focus on quality, innovation, and efficiency. These are all the things that we've discussed in the last 4 days. The customer, you have to get their feedback so that you'll be able to give them what they need. Any product or service you are rendering, if the patient tells you that what you are giving them is not what they want, then you have to adjust your business idea to suit what they want. So for instance, in MMA, initially we were sending results via WhatsApp and email. Then we realized that technology is moving. Now people want to download the results on their own. So we have to put in a system where patients can download their results from the comfort of their home. All right. So this is an innovative way to keep focus on the business. So once you are looking at the quality, you don't leave the innovation where the patient will be the end beneficiary. Okay. All right. So this summarizes what I wanted us to discuss with regard to the products and the service we are rendering in our various facilities. Our closing remarks. Okay, I said this training aimed to make available the thinking behind standardization. We chose one of the best standardization protocols, that is the ISO, and we have explained using the integrated management approach. All right, this is all that the entire 5 days has been revolving around. You will agree with us that standardization is for everyone, independent of the field of work or the profession one belongs to. Let us begin to put in the necessary standard protocols in our various endeavors to ensure quality outcomes. We can easily begin with some of these things that has been discussed. Development of policy and protocols. So wherever field you are, don't just keep the ideas in your head. Try and put them on paper and let everyone within the organization or in your department get to know what you intend to achieve and how you are going to achieve that. So develop policies, come out with protocols, and that will help you in what you want to achieve. There's documentation. Okay, we've spoke much about documentation. If you have your fridges and you're not charting them, once after this training, begin to put in the work to develop the chart. If you have challenge and you contact some of us, we will help you, okay, to develop some of these protocols and charts. There are equally very powerful people on this platform and also on the WhatsApp pages that if you ask, they will be ready to assist. The next one is to getting customer feedback. Don't just assume that whatever you are giving out is being, because you are in a government institution, no one comes to complain much. You can leave things to go as they are. Kindly begin to get feedback from the clients so that you will adjust to their needs. And some of the routines that you think, this is how we do it. If there's a need to change, then you will go ahead and insist on such changes. The last one is training. We spoke so much, and training, without training, whatever policy or document you develop cannot be implemented. If the people are not aware, they can't agree to the things that you put in the policy or the document you want them to put on their shelves. If they don't have the requisite knowledge, then they will not be able to comprehend and implement them. So I want to say thank you very much. I'm going to take you through some few announcements. Once we are done, then we will call for your questions, then we close the section. So the first one is I want to talk about the Ghana Healthcare Leadership Institute. This is something that we've come out with, that we want to build minds around the leadership of our healthcare ecosystem. So very soon you'll begin to see GHLI, where we are going to use all of us on this platform. If you are interested, you want to be a leader, you want to be a trainer, you want to train other professionals, you want to provide any kind of assistance, then you join us so that we'll build the Ghana Healthcare Leaders Institute together, where we'll build ourselves, build others, build the next generation. Then the healthcare will be the biggest beneficiary. So that is what Ghana Healthcare Leadership Leaders Institute is about. It's something that I'm so passionate about. And I believe once the links are shared to invite people who are interested, many of you are going to join us so that we build together. Now on your certificate. So the certificates are going to be available on our website. We are going to send you your details. Hopefully from Monday going, we'll send you the link, we'll send you how you can download your certificate. So that is with the certificate. And we are going to send our data to the council. Once they input everything, I understand this time we are not supposed to upload certificate and those stuff. Once we submit the records of the attendance, then they are, once you log into your profile with the council, then you'll be able to see that you've been awarded the certificate. So, I mean, the certificate will be made available. Hopefully for Monday, we will start sending the messages across on the WhatsApp and also individually, so that you will know the next stage to get your certificates. Now going forward, we're looking to have a lot of some of these trainings, not only by us, but equally from other professionals coming from the Ghana Healthcare Leaders Institute and any other professional we think has a knowledge that we want to share. So let's keep our presence on the platform that we built, on the WhatsApp platform. Our website is also available. You can always go there, and there are numerous of information we'll be sharing across. Our WhatsApp pages are all there, and the Facebook pages are all there that you can reach us. So our contacts are clearly stated here. So our website, mmalabs.com.gh, our email, our YouTube channel, I just activated it. So we're going to load some of these trainings up there. Anytime you want to go back to visit them, they'll be available. Equally, I'm going to upload all the content on our website. So when we give you the link for the certificate, you can go there and download the slides and review all the topics or the content. The videos will also be available for you to go over again. There's also my personal details. So if you want to reach me, you can also reach me, and we can look forward to greater heights. I want to say a very big thank you to you all for giving us the opportunity to share this knowledge with you in the last 5 days. Thank you so much, and your questions are welcome.
Hello. Yeah, thank you, Mr. Chairman, for a wonderful presentation. I think it's worth it. So now anyone with a question can just bring it out as you deliberate on them.
I think Brother Martin. Brother Martin, kindly unmute.
Okay, yeah, Mr. Evans, thank you for this. I just wanted to thank you all for the opportunity given us to at least partake in this training. It's been helpful, and we are very grateful. Secondly, I just wanted to know from your outfit if probably now, as it stands now, we don't know whether there is a category A, B, or C. But we are just wishing that if there could be any opportunity from your end that we can do the other categories, if in case this is A, in this short possible time, because some of us, we don't know where we can get other CPD programs to amend the one that we have now. Thank you.
All right. Considered, we will look at it. And within maybe by close of next week, we should conclude with this. And if we have to, it's possible to get accreditation to offer something as soon as possible, we will do that.
Okay, and then please let us also know whether this A or B or C by the close of the week, so that we know which one we will go for now.
For sure, we are going to do that. In fact, we've been at the council yesterday, we couldn't reach the gentleman, and today is a holiday. So hopefully by Monday, we should get that feedback and communicate as such.
Okay, all right, thank you.
Brother Maswatete.
Please, thank you very much. I want to ask, assuming I bought a glove, how would I know that particular glove has been ISO certified as a standard one to use in my lab or a workplace?
Okay, so what I usually do myself is first to search for the company that manufactures the products.
Okay.
Now, if you search online, go to the website, you are able to identify the accreditations that they have.
Okay.
So that is the basic way I do check every product that I get. So if someone sends me that he has a product A or B, I'll ask you what is the product name. Once you send me the name, I go in searching for the company who produced that product. That is how I need to narrow down.
Okay, I want to hasten to add this, that is there not any means on the product, assuming you didn't have the opportunity to do that, but they just brought the product to you. Are there some indications on product that can tell us that this a product has been ISO 9001 2015 certified also? Is there anything like that on product? Because this is a knowledge I've come to know newly and I've not looked for, but I want to know if there's something. So from now onwards, I'll be looking at the anytime I see a new product.
Okay, so for sure, some products do have them. I mean, companies who are proud of what they achieved usually have those markings on their products. Most of them have the markings on them. So what I mean is that if in case you check the product and it's not there, then that is where you have to go to search. Okay. So usually, and you see there are some of the products that are that required internal accreditation. So some products has to be accredited by the Ghana FDA or the GSE. Okay. Yes. So you have to look up to those accreditations. Yes.
Okay. Thank you very much.
All right. So
Aminu Bright, can you kindly unmute yourself and ask your question?
Aminu Bright.
Okay, that's even on there.
Derry Richard, kindly unmute yourself and ask your question.
Please, I want to ask a question on the certification. You were saying you tried to get in touch with the council, but today's rather unfortunate is holiday. And with the certificate, we wouldn't take that to go and do our renewal. Is it that after this, that will be sent to the council for them to factor it into our various our individual portal, so that when you go, you only go and do the payment, and you'll be renewed. Or what? I want to get that part clearly.
I think, thank you. Yesterday, I went there to, like, about the categorization. I went there, the one who was in charge of education was not around. So I called him twice and he couldn't also respond. So we are doing that. With the renewal, the moment we submit the list, that's why now they require your PIN and the name. So with the PIN and your name, it will be entered into the system that you have attended the ISO, the practical understanding of ISO, the integrated management system. So the moment the list is sent there, it means everybody who partook this training, his or her name will be part of the list. So you don't even upload the certificate again, but they use the list and your name corresponding to the PIN. So what you need is that if you have entered, that was why we're requiring the pins for you to, for you to enter the right pin. So if you have entered the correct pins, then you don't have any issue. Oh,
okay. I'm cool with that. Just that last year, I wasn't in the country, so I couldn't renew. I understand I'll have to pay some penalty. I'm a military officer, so I was in international peacekeeping mission. So I came this year. That's why I'm so serious in getting this CPD to renew this year. So I don't know whether I will need extra to renew. I will need extra for last year, or this is okay, just that I will pay a penalty.
Okay, thank you. Like with the PIN renewal, the CPD, the year that if you don't need, last year has passed, so either you attended a CPD or not, it is this year that they will look at the CPD that you have attended. So you don't need to get extra. The moment, if you're a scientist and you're having the 20 points, then you can renew. But you don't need more to renew the piece.
Oh, okay. Thank you very much, sir.
Thank you too.
Yes, sir.
Aminu Bright, kindly unmute yourself and ask your question.
I think he was not available earlier. So Obedo.
Yeah, hello. Good afternoon to all. My question is, some of us fortunately have attended other CPDs and have gained some points over there. So the knowledge we know is that once you submit the list to the council, they find out which category is left for you to fill and automatically upload your certificate over there. But I heard some people asking whether it's category A, B, or C, which I kind of have some confusion over there with the earlier knowledge I have about the upload. So if that can be well rectified, I'll be glad. Thank you.
Okay, well noted.
Thank you. So I think that the issue has to do the information that we have to get from the council. So like what he is saying, it means that if you have category A, then the council will just add this CPD to category B or C. You get it, Evans?
That is what? No.
So if that is the case, but we still need confirmation from the council so that we know we will have the right information to give you. Yes. All right. So, Evans, I thought there's no one.
Okay, if there is no question, then I think you can bring the meeting to a close. So thank you all for your patience and the participation, for the confidence that you gained in us and you decided to join our CPD. And we assure you that there are more coming. Next year, we are going to have a bigger one with some big men giving us presentation in various topics that are very important in our setting and as young ones coming up. So let us be alert that you hope that our next training you join the same way we did for us. We are much grateful to you all. Thank you.